Hi everyone, it's Dr. Cary here, and welcome to today's video on core strength. We're going to talk about why core strength is important and then some of the exercises you can do to help yourself during this healing process. So the first thing I want to go over is the skeletal system. The skeletal system is composed of the spine, and the spine is straight down the middle from right to left, and then has some curvatures to it from front to back, so that's important. And then the shoulders attach on the spine, the hips, everything should be nice and level, and this is kind of the foundation to the body. The muscles are over top of the spine and connect the bones together, and they also go some of the layers go over several bones or a section of the body or a couple sections. So there's different layers of muscle and they perform different tasks, like some of them are postural support, some of them are for movement, some are fine movements, and some are like larger gross movements. So the muscular system is very important, as well as the skeletal system for good posture, mobility, health in general. So why core strength? Well, as a chiropractor, we want to work on your alignment and improve your alignment so you can do the things you love to do, so your health is restored. It reduces pain, increases flexibility, and we really want to work on the flexibility first. Second, as your pain's reducing and you're getting more flexible, working on core strength is good because it supports the progress that we're making in the clinic. So it helps stabilize the spine, holds things in place, and prevents re-injury. The first exercise I wanted to go over with you is the partial sit-up. And here in this picture, I'm lying on the ground. I've lifted my shoulders off the ground. My arms are up at an angle. And then my feet come off the ground and my body forms this V type of position. This V position is very good to contract the abdominal muscles, and you want to hold this for about 3 to 5 seconds to start. Later, I'll tell you how you can go to the next step with these exercises. But just to start, hold this for 3 to 5 seconds to get used to it. The second exercise that I wanted to go over is the side plank. And here, this person's lying on their side, and then they lift their hips off the ground to form a neutral position for the spine. So you want to form a straight line like this. You want to hold this for 3 to 5 seconds, and then you want to switch to the other side, and this works the lateral muscles on the sides of the spine, so on the right and the left side. Exercise number 3 is back extension. So for back extensions, you want to keep your stomach on the ground, lift your arms and your head off the ground, and lift your legs off the ground as well. Some people like to keep their toes touching the ground. I try to lift my feet off the ground while I'm doing this, and this provides more of a contraction in the extensor muscles on the back part of the spine. You want to hold this for 3 to 5 seconds. One of the variations that I like to do is holding this position and then gently twisting to one side and then gently twisting to the other side. So adding a little bit of rotation into this can be very good for building up the extensors as well as the rotation muscles in the body. So make sure you're doing this to the right and the left side. The fourth exercise is the plank. You want to hold yourself in a neutral position like this. So start flat on the ground, face down, push your arms up, and then hold your body in this neutral position where, again, the spine forms a straight line with the body. Hold this for 3 to 5 seconds, and then if you're getting good at that, you can add a variation where you stabilize your body and then you lift one arm and you curl it underneath your body, so you reach to the other side. And then go back to that neutral position with both arms on the ground and then do the other arm. This requires some balance. It requires some extra core strength, and it's the next step to doing the plank, which is a pretty standard type of exercise for core strength. The fifth exercise I wanted to show you is called the bridge. The bridge is when you're lying on your back, you lift your hips off the ground, form a neutral, flat position with the body. And then what you want to do is hold this for 3 to 5 seconds. Once you get good at that, a variation of this is lifting one leg up in the air, keeping the other leg on the ground. Again, this requires some core strength because you don't want your hips sagging or falling down to the ground. So you really need to stabilize your hips and keep your body in this neutral position. And then you want to switch, put your foot down so both feet are on the ground, and then switch to the other foot. So in general, we want to start with doing this 3 to 5 seconds for each activity, and then increase your duration. You should be able to get into the 5 to second range, or longer than 10 seconds eventually. You want to do 8 to 10 repetitions of this these exercises, and you want to do 2 to 3 sets. So eventually you want to get up to 2 to 3 sets, and then to twice a day. So when you first get up in the morning, you can do this, and just before bed, or maybe just before breakfast, just before dinner. Those are good times. Maybe it's on a lunch break at work. So these are good times of the day to do it. Try to anchor a new activity like this to an existing one. So something you do on a daily basis. And that'll bring up the strength and the endurance that these muscles need. If you have any questions, feel free to ask me in the clinic. And if you're seeing another health professional, consult with that health professional before you start these exercises, because there might be some specific recommendations for your condition. So everybody's a little different, and getting the right recommendation for your condition is important. Discontinue these exercises if you feel sharp pain. So sharp pain is usually a sign that you have to stop or discontinue. Burning, soreness, feeling like you've worked out is normal. So sometimes the muscles will burn a bit, get hot, or afterward you feel kind of sore like you had a workout. That's normal, especially the next day when you first start these exercises. But if you feel any sharp pain, you're feeling any dizziness, any other symptoms, stop these exercises and talk to your doctor about it. I'm located at 1628 Dixon in the Landmark 4. That's in Kelowna, British Columbia. If you want to book an appointment, there'll be a special offer in the show notes today. So you can click on that offer, and then you'll get a discount to book the first appointment in the clinic. Follow us on social media. It's at Dr. Cary Yurkiw on all the social media channels: TikTok, Instagram, Twitter, Facebook. It's the same handle. And we do have a podcast called Super Healthy. That's on Android and Apple. So please feel free to follow that. And we'll be posting a lot of these audio versions on the podcast. Our website, drcaryyurkiw.com, we just redid it, and it has a blog section where I'll be blogging about exercises like this one. And there'll be an event section where there'll be some free webinars coming up, paid master classes. So you might want to join us for one of those going forward. I want to thank you for joining us today. Hope you learned something about core strength, and we'll talk to you guys next time.